Good morning, everybody. Today, I would like to just share with you some reflections regarding the journey of the National Office for Research Ethics Committees over the last year and a half. So I'd like to begin with highlighting that the current operational framework of the National Office is underpinned by very clear and strategic objectives, which is to support the very rich and progressive research environment that we have in Ireland by enabling a national research ethics system. I referenced the Health Research Board Strategy 21 to 25 here as the host organisation of the National Office. The HB provides us with the very supportive framework to enable the operations and the infrastructure required for the National Office and members to deliver on its remit. As an independent unit within the HRB with a statutory function, the strategic priorities of the National Office are to facilitate a very robust and transparent, cohesive national research ethics review system that strengthens the national infrastructure that already exists in Ireland. We achieve this through engagement and collaboration with our stakeholders, many of which are those such as the Department of Health, the Health Products Regulatory Authority, the HSC, and the local recs. And this is more important now than ever as we experience a mixed model research ethics system in Ireland, which effectively underpins the safety, dignity and well-being of our research participants across the spectrum of health research. The priorities and mandate of the National Office is to support the ministerially appointed committees assembled in the various areas of regulated health research through legislation. And the NRECs provide a single national ethics opinion on applications made to them through the National Office. So the evolution of the ethics system and the wider regulatory changes which have been driven by the recent EU legislation. And these regulations were transposed into Irish law, aimed to harmonise rules throughout Europe. And they ultimately improve consistency, collaboration and transparency. They increase safeguarding measures, and we see this through the work of the Health Research Consent Declaration Committee. And it also streamlines electronic submissions and assessment through the new CGIS portal. And ultimately, the aim is to engender public trust and have a more participant-centred approach. So in response to these legislative changes, the National Office embarked on quite an involved journey to ensure preparedness for the imminent regulations. And so an unintended yet welcome response to the COVID-19 pandemic was actually the establishment of the COVID-19 National Research Ethics Committee, which delivered an expedited national opinion for COVID-19 studies. And this set out, I suppose, a framework for subsequent NRECs. And at the Department of Health's request, the National Office is now extending its COVID-19 ethics portfolio, and is currently establishing a Research Ethics Committee for the National Irish COVID-19 Biobank. And so in summary, the National Office establishes NRECs in specific areas of health research. We manage the expressions of interest of the NREC membership, provide operational support for our committees, and we monitor and we provide monitoring and kind of oversight support to the committees, and also issue guidelines where we can and where appropriate for the work that they deliver. We're also focusing on education and outreach to our stakeholders. So the three National Research Ethics Committees currently comprise of 67 members who are exceptionally committed to embedding a national ethics system within Ireland. And for all the consensus-based decisions that are made, they draw upon a very diverse range of expertise and lived experiences when carrying out ethical assessments on research studies. So it's important to reflect, I suppose, on the principles of ethics that underpin the consensus-based decision-making processes of the national committees. And the following slide, I suppose, references very trusted resources that inform ethics practices, including assessment and good clinical practice. And these are internationally accepted standards for designing, conducting, recording and reporting on clinical trials, and these would be consistent with the principles that are set down in the Declaration of Helsinki, as you'd all be familiar with. So more specifically, the committees are tasked with assessing the ethical integrity of studies, such as value and benefit of the studies, and considering if they're fairly designed, and ultimately ensure that the respect, safety and dignity of participants is at the fore of the research. And the following slide sets out a snapshot of the work of the committee since May 2021. And on the right-hand side, you can see there is over 700 decisions that have been delivered since May 2021 through 80 meetings which have been convened. And this, I suppose, just demonstrates the significant amount of work that our committees and the National Office have carried out to date. So in 2023, the National Office aims to strengthen our networks and partnerships and to enhance and complement its work and support of the NREC members. We explore how we can collaborate with the HSC and local RECs and reinforce best practice across the Irish system, and in general enhance the review process more nationally. So the NREC members are the absolute core of the national ethics system, and we continue to support them and enable them to deliver robust ethical opinions. And it's really important that we operate with agility in the face of further legislative changes, and especially going from the Clinical Trials Directive now into the Clinical Trials Regulation, and to manage and deliver opinions on the unforeseen volume and complexity of applications, and to optimise the expertise and experiences of the national committees. So complementary work such as developing guidance and seeking training and expertise, working groups from bioethics councils is critical to ensure the committees continue to instill best practice in emerging areas of research. And so in summary, we strive to achieve an effective national ethics system that benefits the research participant in instilling public and stakeholder trust and confidence. We want to enable the NRECs to deliver excellence in ethics opinions and ensure there's a national complementariness and cohesion, and build a strong reputation throughout. And so lastly, I'd just like to introduce the National Office team, whose diligence and support provided to the committee members cannot be overstated. So I hope that gives you a quick snapshot of the National Office and the work of the committees to date, and I thank you.